Let's talk about brow lift. Brow lift is what it is. We lift the eyebrows. And this is something that we assess when someone comes in for facial cosmetic surgery. I'm looking for superficial changes, brown spots, red spots, roughened skin, fine lines, or structural changes, droopy eyebrows, droopy face, droopy neck. And sometimes those two things overlap. So let's talk about brow lift. Some people's brow droops as they get older. And it's up to the plastic surgeon to distinguish, is that upper lid crowding or sadness or droopiness a contribution of the brow drooping, or is it the upper eyelid drooping, or both? If we're going to do a brow lift, sometimes we'll incorporate it with the facelift, or sometimes we'll just do it by itself. Basically, there's about 4 different kinds of brow lifts. You can make an incision across the top of the head. This is sort of the old-fashioned technique, but it still finds good value sometimes. That's called a coronal brow lift. We can do a brow lift from the hairline, someone's normal hairline, like I don't have, and that's for someone that has a very tall forehead. If we do that, we actually shorten their forehead. So I'm looking for facial balance. If the forehead's a little bit too long, I'll recommend a brow lift right along here. We make that incision sort of curvy and irregular so it doesn't draw the eye. Sometimes we do an endoscopic brow lift where we make tiny incisions and we put a scope in and we operate on the endoscope on the camera, and we can lift up this whole area and advance it up to give you a brow lift. The secret to brow lift is to know how much to lift and how much not to lift. You can always take more, you can't put back, is a good saying in plastic surgery. So being conservative is helpful. What you don't want is brows that are so high that someone looks surprised and the plastic surgeon says, well, it'll calm down, give it a while, which means give it a year or 2. So the idea is to look natural and just elevate them enough to give a more youthful look. It's then up to the plastic surgeon to distinguish or to determine what technique, how deep to go. You can go under the skin, under the muscle, under the layer next to the bone. There is another technique that we use just rarely and only occasionally, and it's usually in men who have deep lines across their forehead. We can actually take an ellipse of skin right out of the forehead if someone has naturally deep lines and lift it. Unfortunately, it's been my experience that these lines right here and here often show, and it's a telltale sign that you can never really cure. We can laser over a little bit, but it is a technique that's used by some people. And again, sometimes we'll do a brow lift in conjunction with an upper lid blepharoplasty or upper lid eyelid